So my name's Kate McCormack and I'm the Senior Drama Therapist here at Bethlem. So, interesting, when I left school I started training to be a nurse, so I had that interest and I'd always wanted to do that, but actually when I started training I was there less than a year and I found out that it wasn't for me. So I left and I did a variety of things before I got into acting, and later went to drama school and did that for a while. And after a while I got more into directing and I began to think about, is there a way of combining my interest in medicine, as there had been originally with nursing, with actually my drama background. Perfect career, drama therapy, is something that I came upon and read about and was very interested in and applied to do the training. So my role now is somewhat different than when I first started. When I first started I used to go to different wards and facilitate drama therapy sessions on the wards. And my role has changed over the years. Now it is very much about maintaining the position of drama therapy in the department, but I facilitate a lot of students and organise a lot of student placements. So at the moment I have a student in the department who's actually at this moment running a drama therapy session, and I also manage and organise students on 6 other units in the hospital. So I do that, that's a big part of my role. And then what came about during COVID time was we had to do one-to-one sessions because obviously social distancing and all of the infection control measures that were in place. So I began to run a mindfulness group, a play reading group. Play reading's resumed now, it wasn't during the time because I changed that to storytelling because that was more appropriate for one person, and a creative writing group. And I still facilitate those, although I've now changed storytelling to play reading. And then obviously there's the drama therapy as well. So the other groups are not specifically drama therapy, but they are run by a drama therapist. So they have a therapeutic content and a therapeutic approach. I mean, I think drama therapy is a good adjunct with other therapies, and interestingly enough, I've just had a case that's been referred to me by a psychologist who feels that there's a bit of a block with accessing the trauma of the service user and has asked for a drama therapy input to try and help with that. So there is a sense that drama therapy works on a slightly different level, and that different level is that a lot of it is non-verbal, that a lot of it is symbolic and contained within the art form, so it has a safety to it. When we look at drama therapy as opposed to ordinary therapy where you have the therapist and the patient, in drama therapy you have the therapist, the patient and the art form. And the art form offers some dramatic distance, and that can help people access feelings that perhaps they can't sometimes in a more ordinary talking way. Seeing change in people, and I think that change can be very small, but it can be very big to a person. I mean, often we think of when someone recovers or someone doesn't come back into hospital as an achievement, but I would never say that was down to one particular therapy. I would say that was the whole multidisciplinary approach. But I do remember one incident when I worked on a self-harm unit many years ago, and a patient was leaving. And one of the exercises I used to do with patients was we'd have these long saras and we'd waft them up and down to music. And we were finishing, it was her last session, I'd worked with her for several months, and I said to her, is there something you'd like to do that we've done before? And she said, yes, I'd love to do the movement with the saris. She said, because every time I change the sheets at home, I will imagine I'm wafting saris. And to me, that is indicative of she was going back to a very troubled, abusive background, but she would have those moments where she could actually imagine herself outside of her ordinary environment. And to me, that felt like a golden moment. Drama therapy is not about performance and it's not about acting. And I say that to any staff that ever want to try it, and also for any service users, because I think that is the misconception. It really isn't that. And I think a lot of people say, oh, I can't act, I can't do drama therapy. It's not about acting. It's about using drama techniques to work with people therapeutically, and it's not about performance. So that's what I would like to clarify.